Hello, I'm Daniel from Creation.co, and I'm here with Mary Kangley. Mary's a research analyst on Creation's team. And Mary, you've been studying the online conversations of healthcare professionals in the UK and the US talking about mental health.
Yeah, so amongst the wider conversation from healthcare professionals online, I found over 1,000 psychiatrists on Twitter who were talking about mental health. Over a 15-month period, those 1,000 psychiatrists authored over 90,000 posts on the topic of mental health alone.
Well, that's a lot of conversation. What were they talking about?
So more generally, in relation to mental health, they were talking about access to mental health services such as the NHS, and also access to treatment, and generally raising awareness for mental health.
So how did they connect into the right sorts of conversations about mental health?
So the psychiatrists used multiple hashtags to connect into not only their peers but also the wider public who were struggling with mental health. They used the hashtag mental health matters.
So what was unique about the conversation you saw among psychiatrists in this particular study?
Psychiatrists, as well as sharing information and educating themselves and their peers, which we see more generally in the healthcare professional conversation, we saw that psychiatrists were also connecting to those who were struggling with mental health, responding straight to those individuals and encouraging them to go and seek help.
So when people were sharing online about maybe their own mental health challenges, you were seeing psychiatrists in the online environment actually coming on and supporting them in a live online environment.
Yeah, and that's really important because the difference between meeting someone where they are and expecting them to come to you can be really important, almost life and death in these kind of situations when mental health is involved.
So Mary, you're writing a series of pieces on healthcare professionals' conversations about mental health. What's coming up next?
Yeah, so mental health is a really big issue and it can affect all of us, so I'm going to be looking at how it can affect healthcare professionals themselves.
Wow. Okay, you can get the full piece at creation.co/knowledge and watch this space for more research. Thanks, Mary.
Thank you.